Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I am continuing here to try to encourage the pediatric departments of universities to teach the pediatric dentist or children doing orthodontics, or if you're doing orthodontics on children, you should know these things too. And so I hope you'll watch this as a simple procedure that everybody, whether you are a child's orthodontist or whether you are just a dentist in some town and you're working on children and this comes up, you ought to know it. And so it's something that should be taught in the universities, instead of everybody having to depend on us people like myself out here trying to get people to do this. Now let's get started, and I'm going to try to rush this. This is a beautiful little girl. She was just fun to work on, and I enjoyed her when she came, and she had an ectopically erupting 6-year molar. That's just a simple word saying the 6-year molar was down under, and this would be a baby tooth here, and the permanent tooth is coming in back here instead of here, and it eats the root of the baby tooth away, and it'll cause the baby tooth to be lost, and now your permanent tooth comes on up way further forward in the arch where it should be, and the other teeth follow it, and if you leave it alone, that's what's happening. That's what takes place. And very few people would go back and push these teeth all back where they should have been and get that in. So they can go and tilt this tooth back like it's just simply uprighting a tooth. Move it there and watch what happens in this. It is so simple. And then they say pediatric dentists shouldn't do it. It is so ridiculous. It just hurts me to see people that are supposed to do this come in and tell somebody working as on children, you can't do this, you're not smart enough. And this is absolutely ridiculous idea. All right, let's show this again. Now, what we did on this child, we put a bar on Creo, and we had brackets up here. You don't even need the brackets to do this. I'll show you that in a minute. All right, here's this child. This is 1986, and this tooth right here is the ectopically erupting 6-year molar. It's like that. In other words, it goes back in here, and the roots are down in it. It hasn't developed, I don't think, all the roots, but it's digging in underneath this tooth. As this goes, it'll eat away the root, and then it eaten away the distal root of this baby tooth was back in here, and then it eaten it away, but it doesn't kill the nerve or doesn't mess up the blood supply to this tooth. This is your baby second molar or deciduous molar back here, and this is the other one, and this is, all you have to do if you got this bond a wire on here like that, and bond it over here and here. Now this hook would be going, we put something on this tooth, and you fix this little spring. I'm going to show that completely here in just a minute. So just watch this. Now, there's the little spring. It would be going down here. We brought it up and hooked it over there. You've got to do that before you bond it, get it bonded on like that. Now, here it is. This look is simple setting out here. But when we started, you had to put this hook over right here. And now, as this tooth came up out of there, this is the 6-year molar now, and that's the second deciduous molar, and this is the permanent tooth. It took this tooth was down underneath this one, pulled it right out of there and pushed it back. Now you could have had a bonded wire in here and hooked it up, would have done the same thing without any brackets. Here it is looking down on it. I want you to see this now, and this is an ectopically erupting tooth. Now I had to take electrosurge and go in and get off. You got to put the tube on the side of the tooth. In other words, you're going to bond it on the side of the tooth, and the spring is going to take it and move it up and back. And so this is right here behind this bond, and as this goes up, as this tooth goes up, it pulls this wire back, and this spring will move over to here somewhere. Now watch that happen. And this is so simple to do. In other words, you can take electrosurge or however you want to, and trim that tissue away, dry it out, bond the tube on the side of the tooth. And I've seen all these stupid ways of trying to get this, putting a piece of metal down in between here, bending it over and bonding it. That's not the way to do it. These teeth are pumping together like that. This works. I have never seen a tilted tooth that I couldn't set up right, even if it's ankylosed. You can go in and break that loose, put this on it. I don't care, it can be a wisdom tooth or a 6-year molar or a bicuspid or anything that is out of position. You can upright anything on anybody as long as they're living. And now they thought that you can't do this or people's bone doesn't move, but that is a big misjudgment, or it's a lie. That's what it is. I mean, you could take a person 90 years old and straighten the tooth up if you wanted to put a bridge in. Now watch this tooth come out of that hole. All right, I'm going to show it on the x-ray now. And we drew this deal right here. You just could, all you needed is just bond a wire in here. Bond it to these teeth. You don't need the brackets up there. This is a tube. Now, this part of this tooth was up underneath here, ate the root of this baby tooth away. Now, I've seen people try to push this back by using this tooth right here, and it'll go like nothing. That's all this tooth has holding it on here. Now let's get a little closer to it. Now, this was after, let's see what the date, that was 2/21 of 86. And now 2/21 of 86. And there is 4/18 of 86. So a couple of months, something like that. She's 9 years old. It's already taken that tooth out and moved it over here. This little old tooth doesn't have but a piece of root in here, but it's still in. It's not dead. It ate it, absorbed all that. Now watch it. It's going to take this tooth and go on further back than that. This hook is sliding down this wire right there. Now let's see, this is 4/18 of 86. And here it is 5/23 of 86. Just a little bit longer. Now this is a blown up picture. This is on the side of the tooth. Now it's not on top of it. This x-ray makes it look like it's on top, but it's not. It's on the side of the tooth. This hook right here was over here when we started, and this was down here. Now look at this baby tooth. It has the root eaten away. Now if you had let this 6-year molar kick this tooth out, it would be over here. This bicuspid could not come in, or else it would come in on the side, or else it would go in that direction like there. This is a simple, easy thing to do. Now this looks like it's on top, I'm going to back this up. Now you see this is down on the side of the tooth. It's not sitting on top. But when you took this with that Tanrex, it makes it look like it's on the top, but it's not. It's on the side, and it brought it up like that. Now you keep this, see this spring right here, it makes this go down here. So it's still got pressure on it. Now we want to keep that pressure and pull this tooth forward, and you put the tooth right up in here behind that, and this stays as a space maintainer. And when this tooth comes up further, it'll eat this root away, and then it will come in, and you'll have your bicuspid sitting in that area like that, except that it'll be a bicuspid. And there it is down there. There is the little spring. Now, if you can't bend that spring, good Lord, you take a tweed loop forming plier, and you can bend the spring like that just very easy. That's upside down. Now this would be what you would put in the tooth right here in the side of it, and this would be down, and that would be hooked over the tooth. So there it is. We're holding this pressure on it. This is the deciduous tooth. It has only one root on it. And now we pull this over here forward, and now you can take that off. There it is there. Goes to here. Pull it to there. And then the tooth will actually just drift up here and hold this gap for this bicuspid to come through. And this is a dirt simple procedure, and everybody working on children should see this, and they see they have to set this thing up. Don't sit around and wait till this does its damage. There's very few people will come back and shove all these teeth back to get this in. They just extract a tooth down here. That makes it where these will have the room that was originally set up for that tooth. So I can't get the pediatric departments to start teaching orthodontics. They won't even let the AOS come and speak to their annual meeting. So somebody in the universities got to wake up, and pediatric departments in these universities should be teaching these things to the pediatric dentist. And if you get out of dental school and you go to a little town, that's what happened to me. I went to a little town, there was no pedodontist anywhere. And I worked on these kids, and I figured out what had to be done to correct it. And if I could figure it from scratch, you can certainly do it too. So I'm passing this on. Thank you for watching. And this is the neatest little gal, and we straightened that up, and her teeth came in great. And so I'm going to side out now and say goodbye, and tune into our channel. I've got 3 YouTube channels, and Facebook is showing this stuff. It's all over the world. And thank God for YouTube and Facebook and whatever, whoever's using this, putting it in and sending it everywhere. So people will know that they can do this regardless of what the schools, if they won't teach you this, they ought to be ashamed of themselves. So I'm going to hang up, and I hope that I can touch schools all over the world to teach the people that are going to be working on children. And if you go out without even getting there and you have a place to work on children, you should know this, and you can go to these videos and see it. And I'll have them stand up get out here before I get too fussy, and I'll say goodbye, and we will close out.